but cataracts can be corrected through surgery. And Storm Field recently visited a clinic in New Jersey which is removing cataracts without asking patients to spend days in a hospital.
It just seemed like everything was not quite as clear as I would like it to be.
It got so that I couldn't recognize the street lights when they turned or whatnot.
As we all get older, the lenses inside our eyes yellow and become slightly cloudy. If that cloudiness thickens and begins to interfere with our vision, the condition is called a cataract. The only treatment for cataracts is the surgical removal of the lens, an operation which in recent years has become one of the most successful surgical procedures in medicine. The New Jersey Eye Center in Bergenfield is believed to be the only non-hospital eye surgery center in the state.
Patient arrives, lies down in a comfortable chair, has an injection of local anesthetic, has a surgery performed, gets up and walks home.
Cataract surgery here takes about 3 hours, and a similar operation in a hospital requires 3 to 5 days of hospitalization. I met 2 patients. Each had one cataract removed in a hospital and another removed at the New Jersey Eye Center.
Well, I had a 3 o'clock appointment, and I arrived at 3, and by 4:30 I was ready to go home. I couldn't believe it. It was so comfortable.
My daughter works, so she brought me out here on a Sunday, and it was done. We came out at 11:30, and I was home again at 2 o'clock.
What is the difference in cost for a patient to come in here and have surgery as opposed to going to a hospital?
The all-over cost is about half because there's no hospital bill. And here at the center, we do not charge for the use in the center.
There really appears to be no difference between the operating room here at the New Jersey Eye Center and an operating room in a hospital. Question is it as safe to operate here as it might be in a hospital?
It's exactly the same type of facility that exists at a hospital. The staff is exactly the same staff that I use at the hospital as well. The anesthesiologist is from Englewood Hospital. The nurses who assist me assist me at the hospital as well. It's exactly the same conditions, exactly the same personnel. There have been many studies over the past, 10 years or so that have indicated that the results are just the same when surgery is performed outside of a hospital as inside of a hospital.
Margaret Denigan is the patient whose operation we observed. 2 hours after it began, she was brought out of the operating room. Margaret, surgery is just finished. How do you feel now?
Beautiful. I'm so relaxed, and it was just like lying on the couch in your own living room.
What a lady. Surgery at the center is done only on those patients who have no medical problems which could lead to complications. If there is the slightest chance of trouble, the operation is done instead at a local hospital. Bill?
Thank you, Storm.